Hello, everybody. Welcome to our webinar today. This is all about getting us prepared, getting us all everything that we need to know about going to the Hill next week. I am Sabrina McCarley. I also have our NARA president. I have Kelly Cooney on the call today. Christy Sheets, our executive director. We are very, very lucky to have both Karina and Nicole here from Williams & Jensen as well to bring such a unique insight and to prepare us for next week. So let's cover some housekeeping items before we get into all the details. So everyone is going to be on mute. The handouts were provided in the reminder email that was sent out about an hour ago. If you have any questions, we ask that you please put them into the Q&A button. For any technical issues, please use the chat button as Christy is monitoring that. This is being recorded and will be posted in the NARA member portal within about 24 hours. So this is really important as we're going to DC because a lot of things change, right? So the information that we are covering today is really just being shared in good faith and for general information purposes only. And it's accurate as of this date and time right now, and things can change in DC at any moment. So one of the things that we want to highlight is we are so excited. The Government Affairs Committee has put together a variety of resources. So there is a new advocacy resource tab on NARA's website for you to access a variety of resources. So we wanted to bring attention to that. And with that, I'm going to turn it over to Christy to talk about our scheduling of our visits.
Great. Thank you so much, Sabrina. Hello, everybody. And we are using a different vendor this year for the spring conferences. We will be using Advocacy Associates. Advocacy Associates right now is scheduling all of your Hill visits. As long as you registered, your name has been submitted and you're along with your address. And so they are working diligently to get all of your meetings scheduled as of right now. They will be providing you with a confirmation of all of the Hill visits that have been scheduled for you. You will get an email from them prior to the conference. It will happen just a couple of days before the conference starts so that it doesn't get lost in your email. It will also be in the app. For those of you who have indicated on your registration that you need a buddy, Sabrina will be contacting you and giving you the name of your buddy and doing an introduction so that you know who each other is virtually. And then when you're on site, we will connect you on site in case you don't know that person by face. You're going to receive these instructions, so don't worry about trying to go through them right now, but you will receive an email from Advocacy Associates about how to access the app so that you can download it onto your phone. In the next slide, we will also provide QR codes, and as Sabrina indicated, you will receive these slides, so you will be able to access these QR codes as we go through this slide presentation probably pretty quickly. But as I mentioned, you will be receiving an email from them. It will give you the instructions. It will give you your username so that you will be able to access all of these goodies right from your phone when you're in DC. These are the QR codes. So if you have your phone available, you can go ahead and shoot those right now. There is a slide deck that also will be provided to you. And then there's a YouTube video there that will walk you through an overview of the app. There is an app for Android and one for the iPhone. Again, all of these will be provided to you in your email in a couple of days. They will also be on the NARA portal. And then you will also get an email from us from the Event Squid platform, which is our conference platform, that will give you these handouts again. So we're trying to get this information to you in multiple ways. And of course, if you need to, just reach out to me and I can get this information to you as well. I will now kick it back over to Sabrina.
Thank you, Christy. So one of the things about advocacy is continuing to build upon those relationships. So advocacy doesn't just start and stop when we're in DC next week. This should be an ongoing process. So let's talk about scheduling meetings outside of conference and how we go about really inviting elected officials into your clinics. So for scheduling meetings, what you will see is that each legislator has their own website, and they're all a little bit different. But you want to navigate it, and you want to be able to see where there's the option to invite them to your facility or to schedule a meeting. So in the next screenshot we have here, I have one of my representatives. I have Mike Thompson here, and you'll see there's a little screenshot that says schedule a meeting in there. What it does is it puts in, you have to put your zip code. One of the things that you will notice is that some of the elected officials, what they're looking for is they want your actual address and they want very specific information. So you want to make sure that if you are going to be inviting them to a clinic, for example, and that's not necessarily the address where you live, you want to make sure you're using the zip code of that clinic as to where you'll be inviting them to. In the next slide, what we have is you'll see that one of the options that they have when you're trying to schedule a meeting is they have different categories, right? They want to make sure that when you're scheduling a meeting, that you're able to schedule a meeting with the individual who actually has knowledge, right? Or who has information or is the best point of contact. So in this, we would put health in the comment section. Some of them do allow you the option to be very specific. So you could copy, cut, paste our top 3 asks that we're going to be providing you in the handouts. You could copy, cut those, for example. The more information that you can provide to them, also, the better. In the next slide, what we have here is to show you how you can invite them to an event. And so in here, you can provide specific dates, even times. They're not always able to accommodate this, but it is nice to be able to give options, right? Sometimes it doesn't always work for their schedule or your schedule, and sometimes it's kind of an ongoing process. So you want to make sure that when you're looking at scheduling an event, and we'll talk about this in more detail at the end of the presentation today too, but you want to make sure it's kind of like planning a wedding, right? Or planning a big party. You want to make sure that there's several weeks or a month or 2 months in advance because all of your elected officials, their schedules are very busy and they fill up very fast. So the most amount of time that you can give them, that's always better. In the next slide, couple of slides, now what we're going to get into is really the details about next week. So when you talk about navigating the U.S. Capitol, this is huge. If you've never gone and visited, you are going to be doing a ton of walking. So we wanted to provide you with a direct link so you can access as much information to prepare, because that was requests that we got last year. So here's just one map, and you can see it's huge. So make sure you have comfortable shoes. Make sure you check the weather, right? You want non-skid shoes. I say that all the time because as we start going into and reviewing the House buildings and the Senate buildings, their floors were not designed by a therapist, right? So they are trip hazards, they are slip hazards, they are fall risk. So I want to make sure you have comfortable walking shoes.
You're such an OT.
I'm very concerned about everybody's safety, right? Nobody wants to fall. So let's talk about our House buildings. So in the House buildings, what you'll see here is there's several of them. So we've got the Cannon building. You'll notice they all look different. This one actually was completed in 1908, and it is the oldest House building. So we have provided you the exact location, as well as I really like these links because you can learn all about these buildings, and you'll see each one of them is different. So I highly encourage you, if this is your first time going and doing Hill visits, or perhaps you've been there before, but you wanted to learn a little bit more about each building, this is a great opportunity just to kind of see what each building's about. Our next one is going to be the Rayburn building. So this was completed in early 1965, so not as old as the previous one. But again, here you have the location and the links. And then we have our Longworth building. And so this was completed in the spring of 1933, and you'll see they all look very different, which I think is one of the cool things about DC personally, how none of the buildings are cookie cutter, and each one is just so different inside. And encourage you to spend some time as you're walking around to really acknowledge that. Then we've got the Ford building, and that was constructed in 1939 for the General Federal Office building. So those are your House buildings. So that is where your representatives will be. Then you've got the Senate buildings, and this is where your senators are going to be. So first we start off with the Russell building. And this is the oldest of the Senate office buildings. And it's got kind of it's an interesting picture that they chose there with the cloudy skies. But you'll see there, we've also provided you the location and the link. And then we've got the Hart building, a very different look, as you see here. And this is the third office structure designed and built to serve the Senate. And then we've got our Dirksen building. So this was the second of the 3 office buildings constructed. And again, you notice they are all very, very different, but we've given you very specific instructions there where the addresses are. So now that you know what the buildings look like, and you know that you are going to be doing a lot of walking and you're going to wear appropriate shoes, one of the things, though, to keep in mind as we talk about what to expect is we are going to be selling really, really cool NARA scarves, right? So it's going to have the NARA logo. So make sure you plan accordingly so that your scarf can go with your outfit. It's got the red, white, and blue theme. So we're looking to see, we really want to do a group picture. We really want to have NARA out there. So those will be for sale before our Hill visit. So just a little tease of what we're doing there. So let's talk about really what to expect and how do we prepare. And really what this is this is our first opportunity to establish relationships and to build relationships, right? So one of the things about advocacy and one of the things about our meetings with our elected officials is that you want to make sure that you're prepared for it. And you also want to make sure that you're aware of the fact that sometimes you're not going to be meeting with the actual elected official, and that's okay. Sometimes in your app, you could get really excited and it says that it's going to be the elected official, and then something happens. A vote was called, a debate was called. There's a lot of things that happen during the day. So you'll end up meeting with a staffer instead. Sometimes the elected official will pop in as well. But one of the things that we like to highlight is the fact that some of these staffers look very, very young. They will look like they're about 12 or 13. They are not 12 or 13, right? But one of the things is oftentimes people kind of get a little off put by that. And they're like, well, what is this person really, what is the influence this person is going to have? And the influence that they have is great. So do not discredit someone just because they look a lot younger than you. Kelly, were you going to say something?
I was going to say they're brilliant people for the
Yes.
most part. And, that each one of them plays a role in that person's office and being the expert in their certain area, which is why it's important on the front end that you tell them what you're there to talk about. Because there might be someone that's a specialist in healthcare or in military or whatever, finance. And so they want to match you with the right person. But sometimes you're not going to get that person because that person had another meeting. And so you may have to educate someone on your topic a little more than you'd expect. And that's okay. That your voice is still being heard.
Mm-hmm. And you want to make sure that in preparation, as you're looking at your schedule, make sure you take the time and before your meeting to really learn about that elected official, right? You want to make sure that you understand their biography. You want to make sure that you understand what committees they're on, what issues they've supported in the past. You want to know if this is someone that is, authored one of our bills or that they've co-sponsored one of our bills, because it's not always about the ask. And I know we're going to be talking about our asks, right? But it's also about saying thank you and educating and building the relationships, right? So this is something I always say, whenever you have that opportunity to say thank you, right? That goes a long way too, because it does kind of feel like sometimes that you're always asking and asking and asking. So I personally think it's also nice to say thank you so much and acknowledge that. So you also want to make sure that you're very prepared. We are going to provide you with today's webinar recording, as well as a variety of handouts in the app. Like Christy said, is going to have all of the handouts. Read that information, become familiar with that information. You want to make sure that you arrive, about 5 to 10 minutes early. Sometimes that they're just sitting around and they'll take you, right? Like you think that you're, just going to wait for 5 minutes or 10 minutes. And sometimes they're like, we're ready if you guys are ready, and, go with the flow with that. You want to make sure that you're polite, that you want to make sure that you are recognizing the nonverbals, right? Sometimes these meetings are like 5 minutes or less, right? And sometimes you get the gift of time and you get like 10 minutes with them. Sometimes what happens is you kind of have a really great plan with your team and you're like, we're going to cover these items. And you notice that that person that you're meeting with is staring at the clock or their phone's going off. Don't take it personal, right? Be polite, but also then make that decision and be able to switch really fast and to say, all right, here's these top 3 buckets, right? And understand that there's a lot going on with them. We also want to make sure, bring plenty of business cards, right? This is super important. So it's super important you don't fall and you wear appropriate shoes, but also we want to make sure that you have business cards. They keep track, right? And they contact you. And I've had them contact me, with questions, make sure you have your business cards. Make sure that you get their business cards, right? But don't overstay your welcome. Don't get frustrated if it seems like they're not paying attention or you're like they're taking a lot of notes. That's a good thing. But also we want to make sure, listen to what they're saying. If they're saying they have specific concerns or they're saying they're actually looking at a different bill, take note of that. And Karina and Nicole are going to talk about that, why that piece of information is also super important. So one of the other things is capture the moment, right? So this is such an great opportunity really to take a picture, share that picture, express your gratitude on social media, tag them, right? But also really, again, I'm going to say kind of feel the room out, so to speak, right? If they're rushing, they may not want to take a picture, right? So ask them first. Don't just assume, right, that you're going to take a picture. Ask them if it's okay to take a picture, if they have time to take a picture. If they do not have time to take a picture, again, don't feel discouraged. Go outside of their office and where there's the plaques. Oh, can't really see it with my background, but there's plaques outside their offices and some of them have plaques. Take a group picture outside of there. You can still thank them for, making the time and hearing about, our issues. So still take that opportunity. We're also asking that when you take those pictures, that share them on social media. So on the next slide, it has what our Twitter handle is, or X. I know people are calling it Twitter X. Probably should change it to X. And then also LinkedIn. Also tag that elected official as well, right? So thank them, right? This is something where it's always fun when they tag you back, right? Or they represent, right? This is your opportunity to highlight that. So now that we kind of have the do's and the don'ts and we understand where we're going and what to wear, I am going to turn it over to Kelly to start talking about what is our asks.
Excellent. Thanks, Sabrina. Christy, you can go ahead and go to the next slide. I think one of the things I was going to also mention, a nice thing to do when you go in is to actually just find out if the person you're meeting with has ever had, or someone that they know and love has had therapy before, PT, OT, or speech. It can be a great way to kind of bring things back to them. When we're talking about supervision, for example, you can say, oh, I know you mentioned you had your shoulder done. You probably couldn't tell the difference between the assistant and the therapist that worked with you because they're all very well trained to provide your treatment. You may have had one therapist that did the assessment and another one that you saw throughout your time there. And so that helps relate it back to them personally. And then when they need to go tell a story to their boss, potentially, they'll have some personal stake. I think that helps a lot. Someone will say, my grandma had a stroke last year and she was in a nursing home and she had all 3 and they did such great work with her. And I really appreciate that. Great. When we can talk about that. So we've got 3 things, 3 of our issues that are high on all of our priority lists. First one is the workforce shortage. And so we've got a few bills that we're looking to highlight when we talk about our workforce issues. And really I really encourage you not to be poor me. I don't have any therapists. This really needs to be beneficiary focused. So we have a workforce shortage, so we cannot serve the people that we want to serve. If it's all about poor me and my business, that doesn't resonate nearly as well. It's important to us, but it resonates well with them. You can talk about employment in their district. My company had to close a couple of outpatient clinics in my district last year. So it resonates that we were treating thousands of beneficiaries in their district and we no longer are. So that kind of information is helpful, but your profit margin maybe isn't quite as helpful to them. So just be thinking about that. So we're going to be talking about the Empower Act, and that is an act that really would give us some relief to, in the long term, to direct supervision requirements for group practice. And then we are also going to talk about administrative burden. And this one is a new, and I think, Christy, we have some future slides that go through each of these a little more thoroughly. So I'm going to kind of do a high level here. And then we're going to also just, so I'll go through the specifics of each of these. But one of the big things that I know are on all of our radar are the reimbursement cuts that we've had. So we're going to talk about some different bills that are going to help us to address that, and what we want to really help them to understand our struggles, and we want to help them to understand some possible solutions. And then telehealth. So that's okay. You can keep going, Christy. So our workforce shortage, we've got folks, that are leaving the profession. We've got salary constraints related to those reimbursement changes that we're going to talk about. Because of this, we have less enrollment happening in the universities to fill our open positions. We also are employees, our therapists are highly trained, and so they are coming out with higher level degrees that come with a lot of cost. And so people are starting to realize that the return on investment might not be there for that cost, since salaries have not changed. So it's making it harder and more burdensome for people to cover their student loan payments. We have, the senior tsunami still happening, right? So we still have an aging population, but they are really wanting to remain active. So there's a need for us. We also are treating, pediatric folks out there in the world, and the choices that they make about fee schedule don't just happen with Medicare, right? They trickle down to our other payers. And so it doesn't just impact grandma. The choices that they make about fee schedule cuts impact that child that's receiving services under Medicaid in a certain state as well, or under a private insurance.
Yeah, Kelly, if you don't mind if I jump in, I think that last point you just made is really important about how therapy services are really for across the lifespan. And we do find ourselves spending a lot of time talking about Medicare. And, there are a lot of challenges that are really specific to the Medicare population, but it does trickle down. And, there are still only so many therapists to go around. And whether you can't see as many pediatric patients or can't see as many Medicare patients, it's still the same amount of resources that have to get spread out. And so, as Kelly said, and starting to talk about the workforce shortage issue, bringing it back to those different beneficiaries, if you can share stories of where you've seen those impacts in your clinics, in patients you serve, that really brings it home for the staff and for the members. You're putting a face on this issue. It's not just a kind of theoretical Medicare payment problem. These are real people that are impacted, both as providers and as patients. And so it's really about bringing it back to the individual, bringing it back to people. And that's going to go a long way in helping staff remember this conversation and having those examples to pull back on when they might get those questions from their boss later about the issue.
The other thing I like to highlight when I talk about this subject and all the subjects that we're going to talk about today is that we are one of the few professions that is uniquely positioned across the whole continuum. So where care happens in healthcare, we're generally there. So we really have a unique perspective on the impacts of the choices that are made on each of those unique practice settings. And how the push-pull, when they start to push something away from one setting, what that does to the next. And how the different choices that are made about reimbursement in different settings impact that setting internally, as well as the upstream and downstream settings as well. So we can be a really great resource to the folks in that office if they're being asked questions about, if we do this thing in skilled nursing, what will that mean for home health or acute care? And so offer that up, offer to be their partner in some of this. I understand what that does. And also we want to make sure that as they're considering any legislation that we've had some problems with CMS in the past with not remembering that the fee schedule is in different practice settings. So things like telehealth, they forget that we're in skilled nursing, right? And that we need to have policy and legislation and statutory language be inclusive of all of those settings. So I like to kind of highlight that as well when I'm talking to folks. And we do, as you can see, there's some data here about sort of that silver tsunami coming our way in the next 5 to 10 years.
And I just would pop in briefly to kind of with respect to what you just said, Kelly, and Sabrina touched on this as well. It's really about reading the room at some level when you're talking to a staffer. As you begin talking about your business and talking about some of the challenges that you're facing, you usually are able to tell where their interest lies. If they are more interested in the Medicare population, if they're more interested in workforce shortage, like you'll have these 3 issues top of mind. But oftentimes the conversation just naturally progresses in a way where you can tell where they're going to be most likely to weigh in with their boss.
Yeah, and actually now as I'm going through this, I wouldn't put this first. When you're actually meeting, and we'll try to arrange it in the handouts in a different way as I'm thinking about this, because I think our Medicare issue is probably our highest bang for our buck issue, then telehealth, and then sharing our stories here. But the more likely to be impactful conversations, I think, are going to be on do you agree, Nicole and Karina?
Yeah, and I would just say like these staffers are overburdened. They have too many issues that they're handling. A lot of them do healthcare and also do other issues as well. So they are really motivated by learning the issues and understanding the issues that are going to come across their desk as they have to prepare their boss for a vote. And so they will be interested, at a very high level in what you have to say. And they're also going to be interested in it at a more granular level. And it is fair to say that there's not going to be a big Medicare bill in the coming months, but they are all sort of thinking about the fact that there will be a lame duck Congress towards the end of this year. And in that time period, their boss is going to have to make decisions, a lot of which are going to relate to telehealth, a lot of which are going to relate to where the Medicare dollars flow. So I think that's right, Kelly. They're going to have to be thinking about how to prepare their boss for those difficult votes as it relates to Medicare reimbursement. And the last thing I'll say is just, you are seeing the table start to get set in the Senate Finance Committee and on the Hill. We had someone from Energy and Commerce here the other day talking about like what's next year going to look like. And there is an effort underway with a lot of members of Congress in trying to revisit the fee schedule and how providers get paid. So at a very macro level, I would just say educating these folks, especially some of the younger staff, to make sure they understand that you all are paid pursuant to the fee schedule. And as they're thinking about how to fix that, they need to think about how to fix it for you as well.
Perfect.
And I think an important thing too to remember is not every meeting you do is going to be the same.
Yeah.
You may go into a meeting and staff is responding to one thing, or staff has questions that lead you in a totally different direction. So don't feel like you are stuck to a script for your meetings. And we have a lot of different bills and points on here that you can make. Don't feel like you have to get through all of that either in every single meeting. Let the conversation flow and go with where the staff is interested, because they're going to be more receptive to that information if they're interested in a topic and see you as that expert that you are in that space. So don't feel like every meeting has to run the same, that you sort of have your script to get through. Let it be natural. Let your group come together and decide what you want to emphasize and talk about in a different meeting. We'll talk a little bit about that more a few slides down about just that process of the meeting, but don't feel like, you can't change it up from one meeting to the next.
Yeah, great point. I was in one recently where we just veered off into bundled payment because she was on some committee that was looking at that, and it wasn't on my talking points at all, but I had some thoughts, and she was happy to hear them. So yeah, absolutely. They may have, or you may have someone that sponsored a different telehealth bill. There's a bunch of telehealth bills out there. And so you're going to want to really focus in on, when we get to that, on why they want to include our language, but you may not be selling the other bills because they're not going to sign. They have their own. So there's some things like that where you may need to switch up your talking points a little bit. Okay. So we kind of know a little bit about the workforce shortage. I think you're all pretty comfortable talking about that if you do have examples. So what we're really looking at to help us with workforce are the Empower Act for supervision. And we've included links to our Dobson report that we helped fund that gives savings with that we feel like they could use then to offset some additional costs that they may want to put in play elsewhere. Some of the other things we're asking for. The Reduce Act is a new one that helps us reduce administrative burden by not having us have to have signed plans of care and updated plans of care. You would have to send them off to the physician, but not chase after them. And I think all of us think that would be wonderful. And then we would love to be included in some of the scholarship and tuition reimbursement programs. And also the ability to bring folks in, qualified professionals from other countries more easily. Okay, next slide. So this is one of our biggies, payment reductions. We've got a little table here that you can share that kind of shows our plight over the last several years. And really our focus is just we can't handle any more. We have another 3%, that 3-ish% that's looming. If there's no action this fall, or not, sorry, this kind of Q4, that would take place in 2025. So we need to be, telling them we can't absorb that anymore. And we actually need some help with the ones you've already given us. So go to the next slide. Here we've got some impacts. These should be yours if possible. Do you have something in their district where you've had to close a clinic? Are you having a hard time? You don't have enough therapists in that area. And so you've got a clinic that's understaffed and is only able to treat half the people they used to. Those types of things. So if you've got some specific examples, use them. Next slide. So here's another little table that kind of shows the conversion factor changes, inflation, and salary, and what that's done to our reimbursement versus what we're paying people. So next slide. So what we're asking for this, there's a few options here. We're back to the Empower Act. So this one touches a few places, and that's where we would have the change to general supervision for PTAs and OTAs instead of the direct supervision requirement that's in place. HR 2474, and it's a little in the weeds to talk about conversion factors, but let's just say that basically what this does would create sort of a standard increase to the Medicare Economic Index, creating sort of regular updates for us that go along with what's happening economically in the world, which I think we would all appreciate, that sort of cost of living kind of change. The Reduce Act, again, that some of these take a few buckets for us. That's that reducing our burden. I know my organization has a team of people that chase after physician signatures. Many of yours probably do too. That would be a really nice thing to not have to have.
And Kelly, I would just add, that's one that I think is a no-brainer for staff and may not be on their radar. So I think that's a good one to emphasize. Doesn't cost anything, if I'm remembering correctly. It's like just a simple common sense fix.
Yeah, and the AMA is on board with it, which was one concern that we had, that it saves them time too, because their staff is then processing all those on the other end. So
people they love issues that don't cost money, that make common sense, that their boss can claim victory for helping to solve a problem that
perfect
is easy.
We need a Senate companion person to introduce that. So if you're meeting on the Senate side, that is one thing we haven't talked about too much. And I'll just do a little sidebar. If you're in the House side, so you're on one side of the Capitol, there's the House buildings, on the other side are the Senate buildings. Try to remember, if I'm over on the House side, I don't want to talk too much about S whatever. Because they're going to be interested in the HR bills on the House side and the S bills on the Senate side. And so if you start talking about Senate bill, blah, blah, blah. So if you start talking about on the Senate side, if you start talking about HR 7279, they're going to say, is there a Senate companion? So you can say there's no Senate companion for this now, but this is what we're seeing on the House side. We would love to have your support to get that Senate companion. But just be thoughtful of the fact that they're looking at what's going to cross their desk and there isn't currently something there. And so you can't say we would love it's better if you don't say we would love your boss to sponsor HR, blah, 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 when you're on the Senate side. HR 6545 updates the budget neutrality threshold and sets more timely updates to direct costs used to calculate our RVUs. This also needs a Senate companion bill. So this is just another way to try to get some predictability in our reimbursement that's been so volatile. And then the SAFE Act is a new one. And I don't know that it has any, I don't think CBO has really done anything with it in terms of cost. I would think that there probably could be some increased cost associated. But it does ask that when a patient has their annual or initial Medicare visit with their physician, that if they've had a fall, that they get a referral to PT or OT. And so that would be really smart cost savings in the end, because we'd hopefully be preventing additional falls and cost. But that one is a newer one, so the offices may not have heard much about it, but it's a great thing. I think most of us can speak from experience about how, boy, we wish we had seen Mrs. Smith 6 months ago when she had her first fall. And we could have prevented the second one that landed her with a hip fracture in the hospital.
I can offer one word of caution too, as we're talking about all these different payment bills. As we've sort of alluded to, staff, while they work on healthcare, may not necessarily be an expert on the nuance of the physician fee schedule, depending on, the member they work for, whether they're on a committee that deals with Medicare. It just means they might not be as in the weeds about it. And you all live and breathe this every day. And so it can be really easy to sort of fall into shop speak. And you use your shorthand to talk about things. So just keep that in mind when you're talking about these different policies, that you're, approaching somebody who maybe doesn't have a lot of background, and you want to be careful with using acronyms and using other shorthand. A lot of times in meetings, I like to ask, are you really familiar with the physician fee schedule? Or kind of starting off with a sort of leading question like that. And they may say, oh yeah, my boss has been working on this issue for a while, or, oh yeah, we had co-sponsored this bill in the past. And you sort of know, okay, great, they've got some background. Or they might say, oh, I'm kind of familiar with it, but not a lot of detail. And that can help guide how you talk about it, because the physician fee schedule can get really complicated really, really quickly. So just be mindful of that as you're talking about all these different bills and things too, of how you're approaching it.
Yeah, if your member is on some of these big committees like finance, ways and means, energy and commerce, their staffers are usually more familiar because these things cross their desk. I met with Sarah Jacobs from California a few weeks ago, and she does a lot with military, and healthcare is not necessarily her thing, right? So her office is not as in the weeds on these things. And so you kind of have to give them a big picture, like here's some bills to look out for and how they would help me, right? Help me help you. All right. Telehealth. So I think all of us have been really pleased with how well telehealth has gone. We want to talk about that. We want to talk about the cliff that is looming for telehealth and how many beneficiaries will not have access to care if they don't do something. And that something may be just extending the waiver again, but something has to happen. And there are, as I mentioned before, multiple bills out there on telehealth, but there are only a couple that actually help us. So can you go to the next? So this one is a newer one. It seems to have a little bit more traction, and it does fix our problem. The Telehealth Modernization Act. Once again, this is HR 7623. There is not a Senate version yet. So if you're on the Senate side, you want to talk about how we'd like to see something like HR 7623 over here in the Senate. It fixes our problem. It basically sunsets the provision in the Telehealth Modernization Act that includes PT, PTA, OTs, and speech paths as Medicare telehealth providers. And it removes that sunset, excuse me. And it would end our restrictions on geographic and originating site permanently. So it just expands access to telehealth for the folks we serve. So that's a really good option. This one, the Expanded Telehealth Access Act of 2024, does a little less for overall telehealth, but solves our problem. So this is a good solution for us, but it hasn't had and it has a Senate companion bill, but it does not seem to me that it's gained quite as much. I think that the Modernization Act was mentioned in the last Energy and Commerce. It's gone to committee. I don't think this one has. And then the Connect Act is one that you may hear about. You may talk about those one or two, and they may say, well, we've signed on to the Connect Act. And we just want to make sure that they understand that we can't support that one because it doesn't include us. It doesn't include that language that sunsets our ability to have access to telehealth. And so we need, if they're going to support the Connect Act, to make sure that that language is somehow added into it. Because it will not fix our problem. And so that's important. It fixes a lot of other people's problems, but not ours.
Yeah, I think this is one of those points, along with talking about things with the physician fee schedule, of remembering that it's not just physicians that are serving these patients. There are other types of practitioners. And I think people can fall into that trap of, oh, well, we're just talking about doctors or even just doctors and nurses, and forgetting all the rest of the providers that are out there delivering care. And so by you going in and doing these meetings with them, you're helping to remind them that, you all are impacted by these policies as well. You also provide really critical services. And if we're not careful in how we word some of these policies, patients are going to lose access. And so this is really part of the education part of your job next week, is explaining to them where you all fit in that continuum of care and making sure that you're not forgotten. We can see this even in some of the workforce issues of making sure, if they're looking at loan forgiveness programs, they think about therapy in that as well. And so, that's kind of part of the job here, is making sure they don't forget about us. And that's why the Connect Act, leaves too much discretion and doesn't give us that permanent fix. And, helping to educate on that is really, really valuable.
And yeah, and I, sometimes you'll hear from them, well, we didn't include you because it costs too much. Right? So we need to be able to say, well, but the cost to beneficiaries of not including us is going to be significant. We can't just suddenly on January 1st stop providing necessary services to people that are receiving telehealth now. It's going to further exacerbate the access to care issues that we already have, that we've talked about in other areas. So, all right. Thank you, Nicole. That's absolutely 1000%. Next slide, Christy. So here's some of our reasons why, and I'm not going to go through reason by reason. And once again, any of these, if you can pick out yours and tell your story about their district, it's going to be better. It's going to be more authentic. You're going to be more passionate, and it's going to resonate more with them about what's happening in the community that they serve. And so, you can certainly share some of and they'll get this handout that's going to have some of these talking points in it as well. But we definitely want to share our input. We're using this in rural communities all the time. Patients, even pre-COVID, had to wait 4 days to get assessed in a skilled nursing facility when we could get the PT driven out there to see them. Now they can be assessed on day one. and start their treatment immediately, which, you know, increases their outcomes and decreases their length of stay. You know, tell a story about what's happening in that nursing home and their community if you can. So here's our big ask. And each time that you talk about one of these things, you want to end with your asks, right? We want you to support the Telehealth Modernization Act. If they say, I don't know that I can do that. Okay, well, next step is Expanded Telehealth Act of 2024. All right. So now we're going to talk a little bit about planning for your visits. And I'm going to hand off to our experts on that.
Karina, do you want me to kick off?
Yeah, I just wanted to tag on to what you just said, Kelly. I think, you know, I used to work on the Hill, and it's a standing joke that, you know, we kind of hated and loved the meetings when people would come in and then not have an ask. I mean, they were great because you didn't have to do anything. Less great because it kind of wasted your time. So I just want to kind of emphasize what Kelly just said, which is it's really important to kind of do your homework, be educated. It is super important. You said it a few times, Kelly, and you can't be overstated. Like, try to connect it back to constituents. All politics is local, and every member is going to care more if you are telling a story about something that happened in their district. And if it's a problem, it is something that they are going to be motivated to try to solve. So I would just say, before you end your meeting, definitely make sure that you have an ask. And then I would even go a step further and say, is it okay if I check in with you in a couple weeks and just see if any progress has been made on this? And you have to thread the needle between being really pushy and obnoxious and also just showing like, I'm really invested in this. I hope I've gotten you invested in this, and I look forward to working together with you as things move forward. So I just wanted to kind of wrap it up by saying that, looking at the slide, you know, I think this is fairly self-explanatory, which is just, you know, make sure before you step in the door of the office that if you're in a group, you know who's going to kind of kick off the meeting and what each person's role in the meeting is going to be. You kind of want to have it all choreographed ahead of time. That's not to say that if a question gets asked or something comes up that isn't according to the script, that you're not able to pivot. But it is a good idea to have, you know, the group ready to go. And, you know, you want to avoid having everybody spend too much time really on their introductions. So if it's a larger group, you're only going to get, you know, 15 minutes, let's say. Sometimes it will go longer. Sometimes it'll get cut shorter. If there are votes, sometimes it'll get canceled altogether at the last minute. So you have to be really nimble and flexible and know that things, you know, on the House side in particular, I've been part of the fly-in where you've had your meeting in the hallway and everybody's standing because the staffers on the run. So I think, Sabrina, you mentioned this at the front end. Don't be offended by that. It's not personal. It's just the nature of the beast. But, you know, I do find that when I'm a part of a larger group on the Hill, sometimes it helps to kind of minimize the introductions just because that can eat up a lot of time and it's really not essential for what you're trying to say. So I think that covers everything on that slide. Nicole, fill in the gaps if I missed anything, please.
Yeah, I think you've sort of hit all the points, and we've talked about some of this throughout the webinar as well. But, you know, having that plan with your group, I sort of like to huddle with my group right before we go into that meeting of sort of, okay, you know, who's going to talk? It should ideally be the person leading it who's the constituent for that member that you're meeting with, or whose company is the constituent for that member. So they should sort of be the leader and sort of decide then, okay, who's going to take this part? I'll take this part. Definitely on the introductions, keep it brief, or even sometimes have that person just introduce themselves when they're going to be the next speaker. So say like, oh, I'm so-and-so from here. I'm going to talk to you a little bit about this, and just kind of dive into it rather than spending that first part of the meeting, having everybody kind of go around the room. And, you know, definitely I can't overemphasize the going with the flow of Hill meetings. And your first meeting is probably going to be your worst meeting of the day because your group is new to each other. You're all trying to kind of figure out your space, what you want to say. And then by your last meeting, you all will have your point that you go to make about something, and you'll have a flow. So don't be surprised that it feels like it gets easier throughout the day, because your group's going to start to gel a little bit more as the day goes on as well. And yeah, sometimes you're going to get those staff who have 20 million other things that they are working on. They want to get through the meeting, they care, but they also have so many other things to do. And so they may not ask a lot of questions. They maybe not even take any notes in the meeting. It's not you, it is not personal. It's just the way it goes sometimes. And then you all kind of go in the hallway and chuckle after that meeting. And we're like, well, we did our best. And you go on to your next one. So just have fun that day. It's supposed to be fun. So have fun. Don't be afraid that you're having fun. It's supposed to be a fun day for everybody and a chance for you to also connect with your fellow NARA members.
Yeah, I totally, Nicole, that's great. And I think one thing I don't think we fully covered either is you talked about meeting in the hallway. I've met in the cafeteria.
Mhm.
And you'll also notice there's vast differences in people's offices. If you've got a veteran senator, they're going to have a big office with a lot of room and nice furniture. And then if you have a newer member, they may be in the basement in a very tiny office with the dregs of the furniture. And so you may be thinking like, well, I'm meeting with this congresswoman and it's going to be really impressive. It may not be. They may really be in a tiny space. And so you may be huddled around a small table in a corner or in the lobby of their little office on a couch, because that's all there is. Sometimes they'll walk you down the hall to a committee room. So just be prepared to just kind of go, okay, sure, I'll, go wherever you think is best. And sometimes you can talk while you walk and get to know them, ask them that question about whether they've had therapy before. But it's definitely go with the flow. You'll see all kinds of things. And I think somebody asked me this once. I met with a very divisive senator at one point, and somebody asked me, like, how was that? I was meeting with his staff, not him. And someone asked me, how was that? And I said, I think sometimes the nicest staffers are actually the people in some of those offices because they have to be. Their whole job is to kind of calm everyone down that's coming in all twitterpated about their boss. So don't be surprised if you go into some place that you're thinking like, wow, this person is not my cup of tea, that they're going to have lovely staffers. That's the other thing is these people's entire job is to listen to you and take not their entire job, but a big part of their job is to listen to you and take your feedback back. So don't be afraid that they're going to judge you or, they're really there. They talk to people all day and they want to hear from you.
And the other thing, I mean, Kelly and I have had meetings underneath stairwells, right? Like where you're hunched over, like you name it, it will happen. So that is part of the fun. Like Nicole said, I really just have fun. And I always, I always want to do like before and after pictures when I take groups. So like when I'm with people who've never done it before, because everyone's like super scared at the beginning. And then at the end, I can't even get a word in. So I always love that before and after and the excitement. So NARA's advocacy does not end on Thursday, right? Like this is something, we want you to take that excitement. We want you to also build the relationship with those staffers, even that person who's checking you in, right? Build those relationships. We understand there's a lot of changes happening in DC. We understand people are choosing, to retire or not to run again, but those staffers, you will build the relationships and they change offices, right? So you want to make sure building relationships and rapport, right, is very important. And don't discredit if you're meeting with someone who isn't running for reelection, because it is still important why they're there. They have voice, right? And it's still important that we're educating and we're asking and we're not saying like, hey, we're going to discredit you because you're choosing not to go, because things change. We want to make sure, invite them for a visit, attend their town halls, request meetings with them when you're at home, follow them on social media. And some of these best practices that I also want to talk about, just about planning for a visit at your facility, at your clinic. So we had an incredible opportunity, Kelly and I, to participate with Legacy Healthcare. Kathleen set this up for us with Jeff Ryan with Legacy Healthcare. It was fabulous. This facility visit, though, really just highlights the fact that politics are an ever moving target, right? So we thought going into the meeting that the congressman staffer that we were meeting with, we were informed that the congressman had announced his retirement. And then later that night, we found out he was not. So it was kind of a different visit, right? So you just never know. We thought one thing was going to happen, and then we were like, hey, so, but really decide on a building that you want to highlight, really look at who are the elected representatives, right? You want to build that rapport, bring them into your building, again, do it like a month in advance and prepare the staff, right? Contact us at NARA, contact Kelly, contact Christy, contact myself, contact anyone from the PAC or the Government Affairs Committee. We will get you the resources, right? So really take that opportunity, and the staff that were there had such a great time, right? With Kelly and myself and the staffers. It was a great opportunity. So the next slide has just a variety of pictures that we have taken over the course of really the last couple of years, but we want to update these pictures, right? But we also want to highlight advocacy still happens via Zoom, right? Zoom isn't going away, but just some different events, and we want to keep adding to those. So the question becomes, who are you going to call, right? You are not in this alone, right? I will make sure at conference, everybody has my cell phone number, because that, if you get stuck or you have a question, call me, text me. But in the Government Affairs Committee, we've got myself, we've got Lisa Chambers, Jessica Boudry, Kathleen Dwyer. In the PAC, we've got Lee Glasso, we've got Chris Batchelor, and we have Beth Payne. So you are not in this alone. We want to make sure you guys are just as excited as we are, because truly, our voices are louder when we're together. And this is the opportunity for us truly to come together and to tell our stories and to build relationships. And we will make sure you guys, everyone's going to get the handouts. I know Christy had put in the chat, there was a Zoom block happening, so she couldn't put the link in. But she will send out the recording. She will send out all the attachments. You will have all the resources. Before you go to the Hill, we're going to talk about it again, answer any questions. The app is fabulous, by the way. If you haven't used this app, this is absolutely fabulous. So the app's going to have all the information that you need, who you're meeting with. It gets updated with the times. It's going to have PDFs of all the handouts. Like, I promise you, you will be prepared. Promise.
Well, one other thing the app has that is super nice on that day, because you could do your research ahead of time, but then I tend to get there and go, maybe it's just my aging brain, but I tend to get there and go, did he co-sponsor that? You can look in the app and see that the person you're meeting with, whether they've co-sponsored your bill or not. So that's really helpful when you're, run into 5 meetings, to be able to look right then and go, okay, so when I go in there, I'm going to ask them to sponsor this one.
I think, yeah, that's it. That's a great point, Kelly. If you only have time to do one thing before you go into the meeting, I would encourage you to do that. Nothing kind of makes you look less prepared than coming into an office and asking someone to co-sponsor something they already have done. Like they will immediately sort of, not take everything you're saying seriously, because they'll feel like you didn't do your homework. So I do think it's important to check. And if they've already sponsored it, say thank you, because gratitude does go a long way.
And we'll kind of go through where to find that information and all that when we're on site together next week in the app. And you can email them back right from there, which is also nice. And it's very slick and easy. So
yeah, and one thing, depending on how much time you have, or if you're as enthusiastic as Sabrina, you might want to do this before your meetings. I always like to go onto the members' website before a meeting and look at their newsroom. You can see some of their press releases that they've issued in the last weeks, months, days. There may not be anything there that is interesting, but you might see something that is interesting. And if you can hook and say, hey, I see that your boss did X, Y, or Z, sometimes that just kind of helps you forge a connection at the beginning.
Yeah, and sometimes I mean that now we're in the age of social media. Sometimes I'll look at the person that I'm meeting with on LinkedIn, and you could say, like, I see that you were on the Senate side before, and now you're in the, I saw that you're his, sometimes that's helpful too, to get some perspective on them if they've been around for a while.
Yeah.
Or you can see that they're brand new. And so they may really not have a lot of perspective.
Yeah, sometimes you can deduce that they're like 21.
All right. Well, thank you, everybody.
Nicole and I are super excited to see everybody and safe travels and look forward to next week.
Yeah, thank you
y'all, and
everybody
good
for your
seeing you.
participation. See you next week.